So the majority of problems I see around the shoulder in lifters tend to emanate from either scapular dysfunction, so the scapula starts to move differently, or some kind of rotator cuff or long head of bicep strain. Now if it's long head of biceps, you're going to find it's going to be in the front of the shoulder. You'll feel like it's in your front delt. If it's one of the rotator cuff tendons, it'll be round about here, so you'll feel it sort of underneath the acromion process, which is that bone that sits there. And if it's scapular dysfunction, you'll find it's at the back of the shoulder. Now unfortunately, because pain is poorly localised, you'll probably find when you've got shoulder pain, you have a bit at the front and a bit at the back. And that's because you start to adopt compensation strategies. So you do things to kind of get around the painful area. The thing that tends to happen with your shoulder is it tends to elevate and protract. So you find that when you're looking at yourself in the mirror, you look like you're uneven, you're asymmetrical, and when you're pressing, it almost feels like you're pressing asymmetrically, whether that's overhead or in a horizontal plane. Now, we're going to do a couple of things to improve scapular function. So there's going to be 3 positions. So if your shoulder's painful in a horizontal push position, we're going to start down in the lower position. If you've not got any pain in the lower position and you've not got any pain in the horizontal position, we can move on to the horizontal movements. And then eventually, once we've calmed your symptoms down, we're then going to get into the overhead position and we're going to start to work our external rotation through there. All the time, our focus is on the back, on the scapula, rather than on the shoulder joint itself. So pre-workout, this is piece number 1. Now if you're struggling with overhead, you're either going to use this position or the horizontal position. Stay clear of your overhead shoulder position because that will just aggravate things. So in this position, we're going to turn around, just so you can see. I'm going to pull the bands apart and I'm going to concentrate on externally rotating my arms. So working through from there, keeping the band pulled apart, and you're going to do 2 sets of 10 in that position. So that's piece number 1. So if you get no pain with your arms down by your sides, introducing external rotation, you're going to move on to piece number 2, which is now horizontal external rotation. So band across your power rack, attach it onto your pins, create some tension, square on. So imagine this is like your bench press. So you're going to get yourself nice and square, scapulars into back pockets, and then we're going to simply turn our hand into an external rotation position. Now what we're doing here is we're firing up all the muscles around the scapula. And if you remember what we said at the start in that video, the scapula is the platform from which you create shoulder stability. So if your scapula's moving differently, or you've got some weakness in that serratus anterior muscle, which is what we're working for, you're going to find this is the way to improve the strength and the stability of your platform, so you can then push in a horizontal position or in an overhead position. So 2 sets of 10 on the left hand side, 2 sets of 10 on the right hand side, making sure your spine stays organised, rib cage stays down, so you're trying to adopt good spinal mechanics as you're improving the function of your shoulders. Right, back to those isometrics. Now obviously we've got our specific press day, which is our log press and our strict log press, and then we've got our assistant press day, which is on the Thursday if you're following the same organisation as the programme suggests, and again you've got some overhead and some horizontal pressing. Now isometrics, which we talked about with the elbow, are a really useful way to reduce pain sensation, but what they also do as well as reducing pain is they start to reload that tendon back up. Now when you're in the overhead position here, what I want you to think about is making sure that your shoulder blades stay down and that your rib cage stays down, so you're braced in that position. So you're basically holding the top part of either your log press, your strict press, or any of your overhead work, and you're trying to adopt as good a braced position as you possibly can do, making sure that you're recruiting all the right muscle groups. So it looks something like this. So we're going to start from here, and we're essentially going to work rib cage down, and we're going to hold in that position, shoulder blades into back pocket, not allowing the ribs to flare. And you can do 3 times 45-second holds in that position. And that's your final piece.